If you successfully control your blood pressure by changing the style of life, the doctor will be able to gradually reduce the dose of medicines or even to abolish them. Blood pressure often increases with increasing body weight. If you lose a couple of pounds, it will lower the blood pressure. Generally, the more you lose weight, the more it will lower your blood pressure. It is also important to pay attention to the waist. If you have too much fat around the waist, it increases the risk for high blood pressure. Your doctor or pharmacist can help you determine the ideal body weight, and advice on how to regulate the bad habits that lead to increased body weight. Not eating late at night. Do not skip meals. Eat 3-5 times a day, small portions, lower portions. Regular physical activity, at least 30 to 60 minutes at least 3 times a week, can lower blood pressure by 4 to 9 millimeters of mercury. You do not need to exercise long to notice the difference. If you live predominantly physically inactive lifestyle, increasing movement gives results within a few weeks. If you have pre-hypertension, exercise reduces the risk of developing hypertension. If you already have hypertension, high blood pressure, physical activity will reduce the pressure. Even moderate activity in 10-minute intervals, such as walking, climbing stairs, window cleaning, gardening, helps reduce pressure. But try not to reduce physical activity only on the weekends. This is not a good strategy. If you have a heart disease or uncontrolled blood pressure, talk to your doctor before taking part in sports or exercise. Taking food that is high in fiber, fruits, vegetables, and reduced intake of saturated fat and cholesterol can reduce blood pressure to 14 millimeters of mercury. It is not easy to change eating habits, but once you start to learn and adopt them in order to feel easier and to have more energy, is no longer a problem to introduce changes. Examine your diet. Keep a journal of nutrition, even just for a week. Keep track of what you eat, how much, when, and why. This can reveal unsuspected truth about dietary habits. Many people bring too much sodium. With increased intake of salt, it is causing an increase in blood pressure. These people often did not get enough potassium. Potassium can neutralize the effects of sodium on blood pressure. The best sources of potassium are bananas, orange juice, avocados, tomatoes, potatoes, salmon, chicken. Be a smart consumer. Make a shopping list before you go to the store and avoid to buy junk food. Read labels when you shop and stick to your plan on a healthy diet when eating in restaurants. Treat yourself sometimes with forbidden foods. Although recommendations for a healthy diet does not include cakes, cookies, meaning that you should avoid them. However, it's okay to sometimes eat candy. Even a moderate reduction in the intake of sodium in the diet can lower blood pressure 2 to 8 millimeters of mercury. To reduce salt intake, consider the following. Reduced salt intake. Table salt is sodium chloride. Instead of salt, use herbal spices, basil, oregano, ginger, pepper. Soon you will be seeing that the spices are a matter of habit. Read labels on food. Look at the sodium content on the label before you buy some food. Some foods will surprise you with its sodium content. Eat less pre-cooked food. Potato chips, frozen ready meals, processed meat contain high levels of sodium. Cut down on the little amount of salt you add to food, to be gradually getting used. Eat more fresh food. Fruits, vegetables, unprocessed foods are low in salt.